The topic for discussion today is young hypertension, another important topic for the medicine residents. Even third year students are having doubts related to this topic. So we'll see the etiology of this young hypertension or the hypertension in young adults. So what is the age cutoff? The age cutoff is less than 40 years. If the age of onset of hypertension is less than 40 years, that can be labeled as hypertension in young adults. Few textbooks mention this as less than 35 years, but most of the standard guidelines and in nephrological textbooks we follow this less than 40 years as the cutoff for hypertension in young adults. Why identifying this is very important? Because if a particular etiology is found that can be treated properly, and long standing hypertension might lead to end organ damage. So to avoid the end organ damage and to give the treatment based on the particular etiology, because most of the young hypertension might be associated with some kind of secondary causes. So to treat that, these kind of young hypertension have to be give attention to the secondary causes. We have to rule out the secondary causes before treating these kind of hypertension in the young adults. So we'll see the etiology one by one. From the most common, we'll start with. In the current scenario, most of the hypertension, even in the young adults, are related to the lifestyle etiologist in the form of obesity, smoking, and there might be family history of hypertension where both father and mother might be having hypertension. But these kind of lifestyle related hypertension usually won't go more than 180. They usually present in the lower hypertensive range, 160, 150, in those range they will present. The extremes of BP is bit rare in these conditions. So this is regarding the most common condition we encounter in our OPD. Mostly obesity, a high salt intake, smoking, and there might be family history of essential hypertension, essential or primary. When we can label the patient as primary hypertension, only if we rule out the secondary causes of hypertension are not there, then only you can label the patient as primary hypertension. As I told, the big clue is usually the BP is in the range of 160. It won't go to a very high range, and they rarely present with end organ damage like retinopathy, renal shutdown. These kind of things might not be there. Coming to the second most common in the kidney, reno-parenchymal cause. Reno-parenchymal causes. This is also the most common cause of young hypertension if it is asked in the multiple choice question. As per the previous year exam entrance questions, if they ask what is the most common, probably they might not give lifestyle. Even if they have given the lifestyle, most common cause of secondary hypertension is the reno-parenchymal cause. What is the reno-parenchymal cause indicate? This indicate all kind of glomerulonephritis. The cortex, the diseases which are related to the reno-parenchymal area, which is the glomerulonephritis. And in young adults, the most common is IgA nephropathy, especially male patient. So this is the most common secondary cause of hypertension. If you rule out the lifestyle, and this comes the first, how will you detect? Usually the routine microscopy, you will pick it up based on the presence of proteinuria or RBC, or there will be a clue of reno-parenchymal involvement. Then what is the third important cause? As most of the UG students will say, as soon as we ask about renal high blood pressure in young adults, they always come up with this answer: renal artery stenosis, which comes under renovascular hypertension. Renovascular hypertension. These are renin mediated. There might be stenosis of the renal vessel. In the old age, it is because of atherosclerosis. In the young adults, probably because of some kind of vasculitis or renal artery stenosis for of various reasons, might present with high BP. These kind of etiology, even in renoparenchymal, the BP might reach extreme ranges, even up to 180 plus. Patient might present all of a sudden with retinopathy. There might be sudden end organ damages can occur in this kind of hypertension. It is a major clue. Patient presents with even sudden pulmonary edema, acute LVF. These are all the etiologies to be suspected. Then coming to the fourth etiology, this can be categorized as endocrine related causes. First is the thyroid. In young adults, hypothyroid is another important condition which causes hypertension. I know many of the UG students and PG students, few of them are on antihypertension medication only with some calcium channel blocker. Their BP is under control. On evaluation, they was found to have hypothyroidism. So thyroid related disease, and in situations hyperthyroidism also, very rarely hyperparathyroidism, can cause this kind of secondary hypertension. So this have to be evaluated for. Most important, from the entrance point of view, from the clinical practice point of view, this is bit rare, but you should know as a medicine resident what are the things to evaluate. Then comes the adrenal gland. In this, you can divide it as adrenal cortex and the disease related to the medulla. Cortex glomerulosa fasciculata reticularis, which secretes aldosterone, cortisol. So the diseases related to aldosterone, diseases related to cortisol can cause hypertension. Diseases I am not going into detail. As a medicine resident, I hope you are aware what are all the diseases. Conn syndrome, Cushing syndrome, adrenal tumors here in the medulla, pheochromocytoma. So these are all the condition which can increases the BP, renin mediated, aldosterone mediated. So this brings into the fourth category, thyroid and the endocrine related, which is adrenal. Second after the thyroid, adrenal we have seen. And third, bit rare, is the pituitary related causes. Acromegaly, ACTH related diseases, high ACTH causes hypertension, can present as hypertension. Fifth one, important in the clinical practice, you have to check what are all the pills the patient is taking. Oral contraceptive pills, estrogen containing pills can elevate the BP. Again, these kind of pill related hypertension, unless the patient have any other risk factor, rarely goes above 180, rarely goes towards 200 and all. Bit rare, but the BP range is in the 160 or below or 180 or below. In this range, these kind of secondary etiology can push the blood pressure. And the last one, again bit rare, which is coarctation of aorta, vasculitis. Any kind of autoimmune vasculitis can elevate the BP. These are the important secondary causes of hypertension. So we have seen 6 important, and almost with this etiology, if you evaluate more than 99.9% of the cases, you will diagnose what is the cause of that hypertension. Most of them are primary or lifestyle related, followed by renoparenchymal. So in summary, what is saying hypertension? Age of onset of hypertension less than 40 years. We call it as hypertension in young adults. First, always check for the lifestyle things, which is obesity, smoking. Always look for the renoparenchymal cause in the form of glomerulonephritis, any renoparenchymal involvement, which include ADPCKD also. Renovascular in the form of renal artery stenosis. Endocrine causes, which include commonly thyroid, adrenal, which is bit rare, pituitary, which is very rare compared to adrenal, drugs. The last one is the coarctation of aorta and the vasculitis related. These are the important causes of secondary hypertension also, and also in important etiology in young hypertension. And which is the most common? Most commonly, it might be essential hypertension, where BP is in the lower range from 140 to 180 range. Family history might be there. Once you rule out all these causes, then you can label that person as primary hypertension, which will be easily controlled with one or maximum two drugs, not more than that. Whereas these conditions might require multiple drugs. So this is all about the causes of young hypertension. You have to evaluate accordingly one by one. So bye bye. We will see in the next video, probably after 3 days.